Hello and welcome to the May edition of the IBD Journal Club. My name is David Gardinier, and I'm an IBD Dietitian with the Center for Human Nutrition at the Cleveland Clinic. I'm grateful for the opportunity to present this month's article, Fruit Consumption is Associated with Alterations in Microbial Composition and Lower Rates of Pouchitis. We're going to start off with a little bit of background. The ileopouch anal anastomosis, or J-pouch surgery, is a common surgery for ulcerative colitis. On the right, you can see what the end anatomy looks like after creation of the J-pouch. The one complication we're going to focus on today is the development of pouchitis. Now, pouchitis is often treated with antibiotics, which indicate that the pouch microbiome might be a key factor in the development of pouchitis. The aim of this study was to evaluate whether diet and microbiota alterations contribute to the development of pouchitis. Moving on to the methods, the patients included had ulcerative colitis and had undergone an ileopouch anal anastomosis, or J-pouch surgery. The researchers gave dietary questionnaires at baseline and at 6 months, and these were adapted for the Israeli population's local cuisine. Fecal samples were collected and analyzed, and microbial diversity was looked at using the Shannon Alpha Diversity Index. Pouch behavior was measured using the Pouch Disease Activity Index, where greater than or equal to 7 indicated the presence of pouchitis. Inflammatory markers such as C-reactive protein and fecal calprotectin were also collected. Looking at the results for diet and pouchitis, a total of 172 patients were enrolled in this study, 39 of which had a normal pouch at baseline. Patients in the lowest tertile fruit intake, which was less than 1.45 servings per day, had a higher rate of pouchitis within a 1-year follow-up. You can see this in the figure on the right. Patients in the lowest tertile of vegetable intake did not have an increased risk of developing pouchitis, and neither did patients who had increased red or processed meat consumption. Moving on to the results regarding the microbiome and pouchitis, 75 of the 172 patients enrolled in the study had fecal samples available for analysis. The researchers found that patients with pouchitis had lower rates of microbial diversity. The researchers also looked at the relationship between different food groups and microbial diversity and found that consumption of fruits and vegetables was associated with increased diversity. The researchers also found that consumption of sweets, snacks, and soft drinks lacked an association with decreased microbial diversity. Diving a little bit deeper into the results regarding pouchitis and fruit consumption, as you can see we have 8 tables here. The top 4 represent 10 patients with inactive pouches at time point 1 who developed active pouches at time point 2. Of the 4 variables, fruit consumption, microbial diversity, fecal calprotectin, and number of bowel movements per day, only fruit consumption significantly decreased between time point 1 and time point 2. Moving on to the bottom 4 tables, these represent 16 patients with stable disease activity who reduced their fruit consumption between time point 1 and time point 2. Out of microbial diversity, fecal calprotectin, and number of bowel movements per day, only microbial diversity was decreased between time point 1 and time point 2. Now to touch on some of the strengths and limitations of this study. The strengths include that it was a prospective, longitudinal study, and that the researchers tailored the food frequency questionnaire to the local population's cuisine. The study was also single-center, which limited variation in the standard of care. Some of the limitations include the possibility for recall bias with a food frequency questionnaire, a small sample size in multiple subgroups, including those presented on the previous slide, and that the results may not be applicable outside of the Israeli population due to differences in cuisine. The authors concluded that fruit intake greater than 1.5 servings per day may be associated with lower rates of developing pouchitis. They also concluded that fruit consumption appears to be correlated with increased microbial diversity and abundance of beneficial bacteria in patients with a J-pouch. They also noted that decreased fruit consumption was associated with disease recurrence and decreased microbial diversity. I also wanted to leave you with some practical tips for implementation. Low roughage fruits may be best tolerated, especially immediately following this J-pouch surgery. These include things like bananas, melons, mangoes, canned pears and peaches, applesauce, and those squeezable fruit pouches. It may be also helpful to limit skins and seeds whenever possible, and texture modification, such as doing a fruit smoothie, may be better tolerated and an easier and less intimidating way to introduce fruit to patients. Thank you for your time, and I hope you enjoyed this month's presentation.